benefits patients in a way that somewhat interventional techniques and other more invasive things can't.
When I went to chiropractic college, like Dr. Fallon had mentioned, we are trained in the more what's called high velocity, low amplitude, like a thrust or a pop or a crack that most patients associate with chiropractic care. So, and sometimes it does work, and I'm not trying to say it doesn't work, but as I was in practice, I worked with someone else who used a Shockwave instrument, which is a gentle tapping device that helps kind of stimulate and wake up tissue, as Dr. Fallon kind of described it to me. And with using it in clinic for over about 12 years now, it just has more of a different type of response that I think patients are looking for long-term results. When we do manipulation to the spine, it doesn't do anything to retrain the muscles. So what I found in talking with Dr. Fallon is the spine is like an extension bridge, but it's upright. If you think of bridge and you see the cables, those cables are like the muscles in the spine. And those muscles are unstable and they lack tone or strength. Then the spine will collapse on itself. Slowly over time will buckle under pressure. And that's when we have this pathology, advanced types of arthritis that gets into the spine, and where some interventions like Dr. Fallon uses are helpful. But in less severe cases, this is a great care strategy for them to increase the tone and tensile strength of the muscles in the spine that give it stability. So the more flexible and strong your spine is, the more stable it is. The more stable your spine is, the less pain you typically have.
From my perspective, so I do interventional spine, obviously, in back pain patients and neck pain and mid-back pain patients all day. At times, there's points where I reach a place and I say, I don't think this is right for you. Whether it's because of the anatomy they have, because of the pathology they have, because of where their pain is, how it is. Out of all of the treatments and everything I've seen, Shockwave has some good data behind it. It shows up not just in chiropractic journals, but it shows up in MD journals as well. And it's something that even my colleagues that do what I do, some of them have it in their office and they do it. I'm not fortunate enough to have it, and I'm not sure I want to do it. And I give it to somebody who's better at it than me anyways. So Shockwave is something, I'll let him talk about more details of it, but it's something that benefits patients in a way that somewhat interventional techniques and other more invasive things can't. And at the same time, it's also a non-invasive treatment that can get to their problem before you have to start sticking needles into things or talking about surgery.
So the Shockwave just is a very novel way of getting into the deep tissue of the spine to help just stimulate them non-invasively with a certain frequency that helps waken those muscles, creates blood flow, and as a byproduct, gives you more lasting stability and strength in your spine that takes your spine from a compressed state to a lifted state. And this millimeters to inches, not a lot. And Dr. Fallon knows as much as I do is it doesn't take a lot of pressure on a nerve to create pain. So when we're working with patients, we're talking about the size of a hangnail. It's tiny, tiny, tiny bits that can put pressure on nerves, or a lot in some cases. So this type of intervention gets away, or this type of technique gets away from a forceful pop or crack, but just a bunch of little taps in the right spot with extreme precision. And this instrument gives me real-time data feedback on the screen that tells me the vibration of the spine where I'm applying it to. So I have control over the instrument at all times. I can turn it up or down to patient's comfort level. I can switch out tips based on the site of the anatomy I'm dealing with. When I work with Dr. Fallon, he will give me oftentimes MRIs I can look at while I'm actually doing the procedure itself, which enhances my care strategy. It's kind of like an image-guided adjustment as opposed to an image-guided injection, which I thought is very, very useful watching him in practice. So that's pretty much how that works. It's meant to increase joint stability, decrease pressure on nerve over time. It's like a little workout or a mini gym for your spine.